Hi guys, welcome to my channel. My name is Tristan. I am an EMT. I am in paramedic school, and I'm also a Marine Corps veteran. I'm an avid firearms enthusiast, as you can tell, just by my belt and my plate carriers that I don't really use anymore in the back, hung up on the wall. But today, I wanted to do a little video about medical kits and why they are so important for just day-to-day use. You may need it. I prefer to have one on myself almost every day, and I've got a small little thing that I like to use for my medical kit when I'm just out and about, and I have just a few things in it, nothing heavy, nothing super tactical or anything like that. But first, I want to talk about why medical is important, so we can all understand that if you don't have training on how to stop the bleed, or you're not an EMT, or you're just the civilian that lives day to day, but you have a family, you want to be able to take care of them if necessary. Now, medical kits come in various shapes and sizes. They have a lot of different things that you can put in them. You can build them out if you want. You can order preset medical kits, which I typically do, or I buy them from North American Rescue online. And the 511 near where I live also has North American Rescue medical kits, and those are usually the ones I buy. They're about 65 bucks a pop. And they've got the majority of the stuff that I keep in here, right? So let's talk about different components of the medical kit. We're going to go ahead and pull this out. Here, let me pull my trauma shears out first. This is a Blueforce gear IFAK. I was using a 511 one that was absolutely massive, and it was not comfortable to work with. It worked for a while. You can keep a lot of stuff in it, but that's something I would probably use more so like on a specific med setup. So like if I were going to put plates in this guy or this guy, and it's going to be a specific medical setup for other people during like a mass casualty incident or anything else like that, that's what I would potentially use that for. So the medical kits that I buy generally include some quick clot gauze. So this is like a gauze pad. So if you've got a pretty heavy bleed and direct pressure's not doing it, or you know it's going to take a minute for it to get controlled, I can show you guys this right here. I'm actually going to flip this around. So you got this quick clot gauze, and this is a hemostat. So basically what that means is it clots for you. It turns into basically a jelly solution, and it allows you to stop bleeding a little bit faster. Now you can, if you get shot, for instance, in the stomach or in a junctional site, your shoulders, your hips, you can stuff this in the bullet hole or in the stab wound if the knife is not still in there. If the knife is in there, keep it in. But for that, you can put this down, and you want it to take up as much surface area as possible, but you also want it to be nice and compact. So I'm not going to open this. Quick clot's pretty expensive. It's like 15 bucks for this little thing, if not more. But no, it's a gauze with an extra component to it. It helps you clot faster, right? Something else I like to keep in my work kit, I also work private security, so I do carry this with me whenever I'm working, is a high-fin chest seal. So if I get shot, these aren't supposed to separate like that, at least I don't want them to right now. If you get shot in the chest and it goes through a lung, you're going to develop what's called a tension pneumothorax. Right? So a tension thorax, or a tension pneumothorax, is when you get stabbed in the chest, and you just got a hole in the chest for some reason, and air is coming into the chest, and it's collapsing a lung. This helps cover that hole by using a vent that allows air out but not back in. So it's going to help you push that air out when you take a breath in. It's going to let the air that's on the outside of the lung escape, and then it's going to help reinflate it slowly but surely. Now, if it's a more aggressive, or you're already seeing a deviated tracheal deviation, that's usually a late telltale sign that someone's about to code on you. This will help you seal up a chest pretty easily. This can also work for stab wounds, freaking anything really that penetrates a chest. The last thing I keep in here is a simple trauma pad. Okay, so what the simple trauma pad does is it opens up nice and big. So let's say you have a small evisceration, you got some perforated bowel coming through your stomach. You can get this wet and cover it up, right? Just like that. You cover it up, you secure it with the bandage, some Curlex, some Coban, whatever you have available, or even a belt if you have that. If you're just carrying this stuff and you need to cover it, you can do that. If the person's laying down with an evisceration, their guts are hanging out a little bit, you can open it up and just lay it down. And then the last thing I have in there, this is my personal IFAK, this is what I keep on me when I'm working, is a pair of gloves. I don't know what size they are. I've also got a couple other pairs of gloves in this black bag right here. I'll show you guys those in a minute. This was my range kit that I used when I went shooting. I kept some extra magazines in there. I didn't really keep anything medical because I had my belt on me and everybody was maintaining good firearm safety when we went shooting last weekend. I do keep a pair of gloves in there because whoever's going to be working on me may not know me and I may not be conscious to tell them that my blood is clean. So I got some gloves in there, BSI, seen as safe, that kind of thing you want to be careful with. And always remember. So that's my personal work kit. Let's go ahead and put this back together real quickly. Now putting it back together, it's nice and simple. I usually do the trauma dressing first, then the chest seals. Just like that, slide them in. Now you can fold the chest seals up quite a bit. There's an adhesive on one side, and that's the side you're going to put to the skin. Some things to note: if you're putting an adhesive on somebody who's super hairy or super sweaty or just generally wet, I've got experience with this with drowning victims, where they get pulled out of the pool. You got to dry them off before you put the defibrillator pads on them, but otherwise they're not going to stick. And the electricity that's running through them could actually arc over their body through the wet conduction that water is, and burn them. So you don't want to cause any burns. That's not good. Now, if it's away from the face, the better it is. Like if you get your hands burned or your feet burned, it's going to hurt to walk or use your hands. You're still going to lose a lot of water because burning causes hypovolemia just by having your skin singed and burned. It doesn't do it any favors. And then the last thing is the nasopharyngeal airway. Now this is a 28 French. It's roughly the size of my pinky. If I had the choice, I would probably opt for 24 French because I've actually put one of those in my nose. And I've tried to put one of these in my nose. I got it. And it was a bit filling, I should say. Now how this works is you put it in your nose. You have to work it a little bit. If you feel resistance on one side, try the other. And if there's no resistance there, continue to insert. And it's going to go back to the back of your nasal pharynx, which is the back of where your throat is, or the air. You can feel in the back of your throat when you take a deep breath in. It's nice, cool air. It's part of the conduction zone for your respiratory system. It sits right about there. And it works its way around your nasal terminates and all that fun stuff. Let's go ahead and stuff this back in there. And why do you want to have a nasopharyngeal airway? There are a couple reasons. One, you can use them on conscious people. So if you have a patient, if you work in medicine, or you are on a TCC team, Tactical Combat Casualty Care, or you're taking a course, try inserting an OPA on a conscious person. In the oral pharyngeal area is what an OPA is. It's a big old hook. I don't have any with me up here right now. But people don't take to it too kindly, especially if they still have a gag reflex. Now there is, for instance, that special section of the population that does not have a gag reflex. I still wouldn't put one in them because if they can still talk and they're still conscious and they're still working it out for themselves, they have a patent airway. You can always tell if somebody has a patent airway if they have an NPA. It's like, oh, that's in my nose. They pull it out. It doesn't do any harm. They just pull it right out. And that's how you know they can protect their own airway. So if you start to put one of these in their nose and they're not very happy with it, they'll pull it right back out and you're like, okay, they still have a patent airway right now. I'm not terribly worried. Now keep it handy if you have a second one. You don't want to use the same one if it's been on the ground, obviously, but if they have a second one, you could use that one as soon as they start to lose their airway, if they do. Go ahead and stuff this back in there. Okay, this can go down to the side. Now for my tourniquet, a lot of you may have been like, where's your tourniquet at? I used to keep a dedicated tourniquet pouch on my gun belt, and I stopped doing that for the reason that it was massive. I want to get one of those tourniquet holders that slides along the length of your belt that can sit about right here, and it doesn't obstruct putting it on or getting off or bending or anything like that, and it doesn't obstruct sitting. But what I have done instead is I rubber banded it to my holster. I don't have my gun with me right now, it's on my desk, but I rubber banded it to my holster. Why did I do this? Because I can grab it with both hands if I have it on. It's easy to pull. I don't want to go through another rubber band. I don't have any more of this diameter and tensile strength right now. And it stays pretty secure right here because the hook loop Velcro section of this tourniquet sticks to the band on my gun belt, or the strap on my belt right here. So you can see how that kind of swings over and secures right there. And it stays there, and it's not moving. It is a very good hook and loop system on that tourniquet for a specific reason. If you lose that rod, then bad things happen. You start to bleed again. Moving on. This isn't something I necessarily carry with me every single day, but it is something I keep in my car, and I've never had to use it. There's been a case where I could have used it, but I didn't have one. And in this, you got another pair of gloves, because if you're doing CPR on somebody, you're probably going to want a pair of gloves if it's a trauma. And then you got a CPR mask. Now this is a one-way valve. You can blow air in, and it's not going to come back at you. But what the one-way valve helps you to do is to help protect yourself against whatever may come out of them. There's been situations where I've done CPR on people, and they've thrown up. That could be for a number of reasons. That can be their body doing things to help fight. Generally, if they're dead, their body physiologically is not responding to much of anything. Or let's say, for instance, you've just intubated somebody and you missed, and you have an esophageal intubation. There's ways to check around this to make sure that doesn't happen, such as listening to your breath sounds, checking for chest rise and fall, listening for gastric sounds, and so forth. When you do that, when you check for those sounds, be sure that you're listening for the gastric sounds first off, to make sure that there's no bloating in the stomach. You can't hear it gurgling. If you give 2 or 3 breaths, or 4 breaths, or 5, however many you need, while you're listening for everything else across the chest, making sure you have good confirmation, that stomach can blow up, and then you get vomit coming back at you if it's an esophageal intubation, which is no good. Now this is a little bit more of my comprehensive medical kit. This stays on the back of my vehicle's passenger seat. So on top, I have yet another tourniquet here. I've got, I think, 4 tourniquets total. One's in my backpack that I take to school with me because I don't want to be without a tourniquet, especially in the area where I go to school in. It's just a general cat tourniquet, like $30 bucks or something like that, 33. And then here, this also doubles as more so a camping first aid kit. So I have some more chest seals. I've got some trauma dressing, so basically this is a way to compress a bleed pretty well without having to use the tourniquet. A lot of people I've seen who end up getting shot or stabbed or something in a limb, they will use the tourniquet first to take care of the bleed immediately, just to get the bleeding stopped. Now they may not need this, especially if they have a hidden artery or a heavy vein. And that's where I've seen a lot of people opt for a trauma dressing after they are kind of calmed down, adrenaline's done being dumped. They'll go back through, secure this, put it on, stop the bleeding with this, or just cover the wound pretty damn tightly. And then if the bleeding continues with the tourniquet, as you slowly, and I gotta encourage this, slowly back it off. Do not let it go all the way, because if you let it go all the way at first, it's going to bust the clot. And then now you are bleeding again, and you could throw a clot that can give you a heart attack, pulmonary embolism, or a stroke. So when you're backing down a tourniquet to help stabilize the bleed and just get it addressed in a different way with this, or some combat gauze, or anything else that could help control bleed, back the tourniquet off slowly. Now these are OPAs, what I was talking about a minute ago. I forgot I had them in here. These are oropharyngeal airways. These go upside down, and then you switch it around. Why? Because when you put it in this way, like it's going to be sitting naturally in the mouth, what it does is it pulls the tongue out of the way, so you have a good airway. But if you put it in like this, it's going to push that tongue back and obstruct the airway. So you got to put it in either at a 90 or a 180 in the mouth and flip it so you can get that tongue out of the way and it pulls it forward. Now how you size these is going to be from the tip of the earlobe to the corner of the mouth. So this is probably right about my size. I generally go for a green. That's a little bit too short, actually. I like that purple a little bit more. So if I was in a situation where somebody had to use one on me, and I'm not conscious, obviously, because you don't use these on conscious patients, you could use the purple. Now some other things I keep in here, as this is my backpacking kit, I also keep some iodine and neutralizing agents so it doesn't taste all that horrible. Now, this is a 22 French nasopharyngeal airway. You can see how tiny that is. There you go. And then for my camping kit, I just keep some Tylenol or Advil or something in there. And then once again, because I like chest seals, I've got some more chest seals in here with some 4x4s taped to it. And I've also got some Benadryl 50 milligram tablets because my allergies get really bad whenever I go camping. This is mainly used for my camping trips or in my car when I am just traveling around. Somebody needs help, I can help them if need be. Now, there are situations where you may not want to use all of this, and Good Samaritan law helps protect you, but if you have trained experience as an EMT or a paramedic or a doctor or a physician's assistant or an RN, sometimes these things can come back to hurt you. You've got experience and you did something that ended up hurting the person. It doesn't happen very often. Like, let's say, for instance, a pretty common one, not so common, but you give an IV and you drop the IV, or you don't sterilize the IV field where you're trying to get it. Let's say somebody gives me an IV in my forearm right here is a pretty good vein. You don't clean it off and it gets infected. That can happen sometimes. But whenever I am looking to see if somebody needs help, I generally don't go all out and pull everything out of my bag. I'll gauge it. If they just need an airway, I'm just going to give them an NP. If they need help controlling the bleed, I'm going to give them a tourniquet if it's a extremity bleed or they've been shot or stabbed or their hands caught in a lawnmower or anything else like that. If it's a trauma dressing, that's just going to help control the bleed. If they need CPR, you got a CPR mask. Now, the American Heart Association does do one-person CPR now without breaths. So there's science behind it. I'm not going to get into all that right now, but that is there. If you're not CPR certified, first aid certified, and you have a family, or you work in public safety, or you are around people on a day-to-day basis, I highly recommend that you go and get some sort of training. It doesn't have to be to the EMT or paramedic level. It can be a CPR class and first aid class, and that's going to suffice just fine for the most part until somebody else can get there. What I recommend doing is just getting a little bit of training so you can help take control of a situation before somebody inevitably or unfortunately expires. Now, on my little bag here, since I did use this in the range, I just stuffed an extra tourniquet in there. And I used to keep this tourniquet pouch on my actual gun belt, but I did not like how it fit when I sat, so I took it off and put it on this bag. This can also be used, I did put magazines in here. There are spots for them and for 2 different compartments. You can get probably a total of 6 in here if you stuff stuff, if you really get them in. But this can be used as a med bag. I've used it as a med bag before, just basically keeping extra flushes for my paramedic that I was working with earlier this year, or extension sets or tape or anything or that I could use at a BLS level. I'm working on an EMT truck only. Now this is more so of my training kit. So I got some nasopharyngeal airways. These are larger diameters that you wouldn't expect to have to use. Most people are 24 to 28. Got a 30 French. You can see the size of this guy. It's quite a bit larger than my pinky. And then you got a 32 French, which is also quite a bit bigger than my pinky here. Now, for training tourniquets, I do have a bunch that I bought off Amazon. These are cheap ones. Don't ever buy Amazon tourniquets unless they're specified CAT from North American Rescue. because they have a few faults that they can break easily. The straps aren't as strong when it comes to tightening the windlass down, and there are a few giveaways that you have when recognizing the kind of tourniquets. And we're going to do a side-by-side here. So number one, the red tab is the wrong shade, and there are no black dots on the real cat tourniquet. Number two, the strap is gray on a real cat tourniquet. The strap is white on the fake one. And number three, on the cat tourniquet, you've got labels. So you can see here. I don't know if you can actually see that or not. Might need to bump up that ISO. That's not going to work for me. But you do have a label here. You can barely see it. I apologize about that. And on this one, you've got no label. It is not designated cat tourniquet anywhere. And just as well, on the back plate, or on the back of the windlass, on the real one, you've also got where it says cat. So you can see the lettering just faintly, if I can get this at the right angle. There it is. That is the real one. And this is the fake. It is nice and smooth. There's nothing on there. So that is the vast majority of my medical stuff that I keep on my person or in my car or at work. But if you guys have any questions, leave them in the comments and I'll answer as best as I can. See ya.